Coffee with Coker is a healthcare business podcast from the Coker Group that focuses on solutions to help healthcare organizations effectively navigate the changing healthcare industry landscape.
Well, thank you for joining us today on this Coffee with Coker podcast here. Today on today's podcast, we have Louis Sallerson from Converse Health. And a lot of times we want to put a spotlight onto some of these vendor partners that we have here who we feel like going to have a lot to offer to clients and potential clients. So Louis, do you want to just kind of introduce yourself real quickly here and just, we'll get going after that?
Sure. So my name's Louis. I'm the CEO of Converse Health, as Chris mentioned. My background actually started in the entertainment industry, funnily enough. So I was in the movie business for 7 years, both doing set logistics management and making horror movies. But I decided I want to do something more meaningful with my life after doing that for a while. So I got my MBA at Haas, and I've been kind of innovating within healthcare ever since. Been part of 3 companies. The first was a digital physical therapy platform called Medicare Health that I ran for 2 years. Second was a care navigator platform called CareDash. That was chief strategy officer, and I started this company in March. And the reason I did is because in both the MSK space and the medical space more generally, what I see as the issue in healthcare isn't really the care itself. I think that's very good in the United States. Like when you're seeing the right specialist, when you're getting operated on by a surgeon, when you're taking medication, that's pretty high quality. But where I see a big need that I think everyone complains about for good reason is everything in between those moments of care. And I've always wanted to solve that problem. And really the only thing stopping us was, what tools do we have to actually do that? That can imitate a real person, that can navigate a patient, that could really automate labor in the last mile in a way that's effective for a practice and acquirable. And we built this company to do just that, kind of on the heels of large language models and generative AI. And ChatGPT's kind of big progress. And so that's what we're doing is we're using large language models or generative AI to create workforce automation and navigation solutions for orthopedic surgical practices.
We'll talk about a little bit more about generative AI here, but I'm just curious to know Converse Health, right? That's an interesting name. When I think of Converse Health, I'm thinking of shoes. But so what's the idea behind Converse Health? The title of Converse Health, was that just an epiphany you had one day? Are you a big Converse shoes fan? Help us understand that story.
Neither of those. So I think a good name is always thick with meaning. It has multiple ways that it could be read. And the 2 things that we and I liked about Converse is, one, it goes to the heart of our product, which is communication, a conversation, right? But the second is that we're a new way of doing things. We're a different approach. And the converse of an angle is the complementary side of something, a different aspect of it. And so we liked that it had that dual meaning, one conversation, but also converse, both on the other side and personal back and forth. And that really just encompasses entirely what we're about.
That's definitely an interesting. That's not the angle I was thinking. Of course, I just didn't know, sometimes these names here, but that's beautiful. Sure. It encompasses your organization and how you value your space in the industry. So I know you kind of talked about maybe let's go a little bit deeper into Converse Health's platform and Sure. What is exactly you do? What are those what's the type of market you're looking into, specialties, elaborate a little bit there for our listeners.
Yeah, so we're really a workforce automation and navigational company for orthopedic surgery clinics. So, what we handle is communication for the patient journey from A to Z, from starting to schedule all the way to post-op along the discrete journey. It's worth talking about what the problems are that we see at these clinics and why we're building what we're building to solve them. So there's a few things that we see at orthopedic surgery clinics from our research. The first is just a lot of non-clinical labor expense, either surgery coordinators, schedulers, call center employees, front desk staff, a lot of money being spent on not the care, but getting people back and forth between it and handling the minutia of the mechanics of a clinic. So that's the first thing that we see. Second thing that we see as a problem is the conversion rates. Right. So at clinics we work with, we see 5 to 10% conversion rates of seeing someone in a clinic and getting surgery. And some of these surgery clinics are not those that offer, PT or pain management. They only do surgery. And that seems like an awfully low conversion rate. And the reason why that happens is a lot of because, the bandwidth of these human beings handling the navigation and the lack of knowledge on the part of the patient. Right. So here's an interaction that I've seen before when we were like tailing a doctor for our first clinic, New York Sports and Joints. I saw a patient walk in to a clinic room, and the doctor and I were sitting there, and the patient says, I'm feeling great. I've been getting physical therapy. My range of motion is returning. My pain went from a 7 to a 3. I feel good. And everyone in the room's nodding. This is good news, right? But the thing that's frustrating is, why are they seeing a surgeon?
Right. Why do they need to see? Yeah, exactly.
Yeah. And when you think about the opportunity cost of that 15 minutes of the appointment, both who could have been scheduled there instead, a more urgent case, where this person could have gone, that person took out their entire day or 3 hours of their day, maybe to go there in person just to be like told. And the reason why that happened is just a lack of information and navigational effect, right? If what we had was leading into that appointment or leading to the scheduling knowledge of what that patient was going through and the flexibility to move them somewhere else, right? We would have for that clinic be suggesting they do a telehealth appointment, or maybe saying they don't even need to come in at all.
Exactly. More benefiting the patient.
And so that's really where we see another problem. And then the other problems to tackle, we see is one, just surgery cancellation. And that happens to do and delay, like from lack of medical clearance, from user patient error, right? Prior auth coming in late, all of those things. And again, you're handling surgery coordinators are handling those things in a very kind of archaic, kind of back and forth form right now. And then post-op, which in a lot of places is really awful. I've seen post-ops where, I saw a patient coming out of anesthesia, and then a nurse walked up with them. A nurse, by the way, they didn't work for the clinic that operated on them. A nurse that worked for the ambulatory surgery center would approach them with a piece of paper, read off the piece of paper when they were just coming out of anesthesia, give it to them, and shove them out the door. Right. That was it. And the day I visited that clinic in the ASC, 20% of the surgeries that I saw were revisions. And that makes perfect sense, right? Given that that's how we're guiding people to take care of themselves after a complicated medical procedure. And so at Converse Health, we're trying to solve kind of the broad spectrum of those issues. So the way it works is, okay, let's go take the patient journey from beginning to end. Patient calls in to schedule. We either offer a way that they can be on voice with our product, text message, SMS back and forth, or even talk to a website widget, which will be a custom large language model powered prompt and generative agent that will talk to them, get the information they need, and schedule them. And that does two things.
This widget going to be embedded within a client's patient portal or website?
Yeah, it could be either. So our philosophy, and I'll make a tangent. I'll go on a tangent for a second. Our philosophy about communicating with patients is that we want to be full stack. Some patients are going to want to talk voice. Some are going to want to do text. Some are going to want to do website, and they might want all three depending on the context of their conversation. So we try to offer all those things, and all those things, by the way, are in beta already. So these are offerable, integratable. If we had a practice that wanted to engage in it right now, we could. And the text message, for instance, is already being tested with live patients. So full stack on depth. We'd schedule the patient, right? And that does two things. One, takes burden off the call center. But second is we can ask as many questions as we want, gather as much information as we want, and then use categories and criteria that are based on like the doctor's specifics, right? The doctor says, okay, if someone has any injury, they heard a pop when it happened, they're 8 out of 10 pain, I want to see them tomorrow. Yeah. And then we can double book that person. If instead there's a category that's lower where it's like they've had physical therapy, right? It's getting better. They don't feel like they should get surgery, right? Then you maybe navigate them away, or you like delay their appointment or give them options that are like further down the line. Right. So navigational element, also a labor force development. Then leading up to the appointment, really do two things. First is gather more information as the condition evolves, because you want to adjust things as you go and ask about how physical therapy is going, ask about how the pain levels are, but also educate the patient, because there's an issue also with clinical throughput. Doctors want to be able to get through as many patients well as they can in those visits and sessions so they can generate surgeries. And a lot of the time they're robots saying rote things. They're repeating the risks and benefits of surgery over and over again, explaining a meniscus. And if the patient doesn't ask about these things or doesn't get them, then they bother the doctor afterwards. And then the doctor has to spend that time giving that communication. So we create generative agents that give them and teach them that through the conversation back and forth. So both gathering information and educating them, improving clinic throughput. Now let's say the patient's indicated for surgery. Now we have a platform that helps surgery coordinators. So right now, surgery coordinator will look at any given patient and make a list of to-dos, right? Okay, this patient is this years old with diabetes. They need this clearance by this date. They need all these things wrapped up for prior auth because it's a workers' comp claim. They need to be reminded of these specific things about medication and what they need to do before surgery. And right now they just do them all, right? And it takes a lot of time. What we're doing is we're creating essentially a version of, one could say, like a MailChimp drip campaign, where all the surgery coordinator has to do is line up these different to-dos, and then a generative agent handles those for them like minions.
When you're working with clients, I'm presuming obviously have the ability to kind of curate some of the education or some of the sequencing of things, right? I think that's kind of key sometimes for clients, right? You have obviously this lovely tool that can help automate these things and use modern day technology at their disposal. But I think at the end of the day, sometimes they want some autonomy as well to kind of dictate, like, hey, when scenario 1 happens, we want this, these are the next appropriate steps. So when scenario 2 happens, these are the next appropriate steps.
Yeah, we totally believe that. And that's why we think LLMs and generative AI is the future, because it's so customizable and fits into people's workflow so easily. So I'll talk about that one way. One way to think about that is the basis of a corpus, or the thing that the generative agent uses as its process. So what we could do is, let's say a doctor wants to educate their patient on a meniscus, and they don't just want rote education, they want their education. All we have to do is get that piece of paper or document from them, put that into the generative agent, and then the generative agent is going to teach them what the doctor prefers about that particular condition. We can customize it so they have different conversations, different days based on condition, patient type. And then also the customization that's really last mile. So, and these are the things that are just like almost annoying, but they really stop technology from being adopted more widely. So one instance is at our current clinic, New York Sports and Joints. They have a doctor there who is going on leave. And that would be a problem, right? Because you need to, anyone who schedules automatically, you need to tell them, hey, this doctor isn't available. Do you want this other doctor instead? Right? And an algorithmic or NLP-based solution would take like a week to change that over. What we did is we just changed the prompt, tested it, and in an hour we launched it. And it just, now what it says is, this doctor is on leave. Would you like to see Dr. Wright instead? And that's how quick these things can be turned around and deployed with quality at scale. So it's like turnkey, last mile, custom. Those are the real strengths of our platform.
No, that's awesome. Yeah, because sometimes you work with other vendors. The turnaround time in terms of some of the customization work that they want is not necessarily an hour or 2 hours. Sometimes it's weeks, right? So I think that's an awesome value add that you guys have here. In terms of practice management systems, EMR systems, who are you kind of integrated with today? And, what other platforms are you looking to integrate with down the line?
Yeah, we're set up with FHIR in the sandbox mode, so we can integrate with anything that uses that standard. We're integrating right now with Athena, and that should be done within weeks. So by the time anyone hears this and wants to sign a deal with us, I'm sure tons will. We're probably integrated with Athena. And then we also, for smaller EHRs, we can do like scraping or admin type stuff. So the way it usually works with us in terms of implementation is from we want to start using this, it's about a month or to a month and a half. And two things happen simultaneously. We do a custom integration with any partner to make sure that it lives alongside their current system and people don't have to adjust their workflows. And second, customizing the prompts for them, so that it's truly just taking what they do as a standard operating procedure and either automating it or making it better based on their request, and also the education and the content.
In terms of just, pricing packages, what does that look like when you contract or take a good look at Converse Health?
Yeah, so we're signing our contracts right now, and those are our initial ones. What we're seeing is, and this really depends on the value and what suite of products people want, but we're seeing just for like the workforce automation settling between, depending on the number of surgeons, $2,000 to $4,000 a month, which we think is a good deal because it's really based on like the value we save on workforce automation. Just to give you an example, one of the practices we work with, in part of our like pricing. Right now, they spend about $250K, $300K on their call center scheduling, and we can get that down to $150.
Wow.
So we're just asking to kind of do that. And that's only one portion of our solution. We really, at least at this stage of our startup, are trying to build deep value with customers and then figure out pricing from that, and go from there.
Well, in terms of, obviously you have this great tool, what is your future outlook on the market and just in general, the future roadmap for Converse Health?
Yeah, I think optimistically, what we're not seeing any LLM-based companies or generative AI-based companies playing in ortho yet, or in like the surgical specialties. I think people right now are going after the large health systems, and I think that's a mistake. Because I think it's the mid-sized practices that really are going to be the big people who benefit here. Because the faster time to customization, the faster time for working within someone's workflows, the faster turnaround on changes. What that really moves the needle for is not the large enterprise, which could command that anyway. It moves the needle for the 10 to 20, 30 surgeon practices that just had, when they had technology before, it was like taking a square peg and trying to fit it in a round hole. Whereas we make it seamless. So that's where I think we'll be. And I think we have a lot of potential to kind of dominate that part of the market and really work well and get a claim. And, just by kind of learning from the clients that we have initially, really making our solution very broadly applicable. So I think ortho is a great market in that it's still very independent, right? The 60%, 65% of surgeries, ortho, are outpatient still. And it's getting that number is getting bigger, not smaller. And there's consolidation, but it's not consolidation necessarily into a health system. It's consolidation into just from a 10 surgeon clinic to a 30, right? Which allows them to pay or think about technology on the basis that we want to sell it to them.
Yeah, I agree with you there. Well, Louis, I want to say thank you so much for joining us today on our Coffee with Coker, Spotlight series on the vendors. Like I said, we view Converse Health as an up and coming vendor here, and we look forward to maybe having you on future podcasts to talk about your outlook on the market and maybe at some point down the line, any new initiatives that Converse Health is in process with. So thank you again, and we'll chat again soon.
All right, appreciate it.
We hope you enjoyed that episode of Coffee with Coker, and we thank you for listening. We want to encourage all of our listeners to participate and contribute in the podcast. So if you have any questions on any of the things we discussed in this episode, any of the topics that were presented, please feel free to ask us. Also, we welcome your feedback and suggestions. If you have any ideas related to the material we discussed in this episode, or in any episode, please let us know and we'll make sure to incorporate it. And if you have ideas for topics you'd like to hear more information about in future episodes, please send those suggestions to us. We would love to hear them, and we'd love to incorporate them into our future episodes. You can find us online and on social media. Start with our website, and specifically the podcast is coffeewithcoker.com. You can also find that through the main Coker website at cokergroup.com. You can also find us on social media, Twitter at Coker Group, and then on LinkedIn, you can search for Coker Group and find our page and the page for some of our team members as well there. So you can find us and reach out to us a number of places. And then if you want to contact us directly, one of the best ways to do that, email feedback@cokergroup.com. That's feedback@cokergroup.com. And again, we'd love to get your feedback. And we'd love to encourage everyone to subscribe to the podcast so that you can be notified when future episodes are released. We look forward to the next episode, and we look forward to getting your suggestions and feedback on this episode. Thanks for listening, and we look forward to speaking with you again on future episodes.